Today, I'm going to talk about how I brought change to Pennsylvania from being just a mom to becoming an advocate and the lessons that I learned along the way. Before I begin, here are my disclosures. I'm going to talk a little bit about who I am and my family's journey with Krabbe disease, what I did, including Act 133 of 2020 in Pennsylvania, and what I learned about effective advocacy, which may surprise you. My name is Lisa Brackbill and I live in Hershey, Pennsylvania, but I'm originally from Northern California. I've been married to Brennan since 2010 and we have 3 children, Victoria, Isaiah, and Caleb. I have a bachelor's degree in political science and a master's in strategic communication. I also have lobbying experience. I am an author, an advocate, and I helped start the Leukodystrophy Newborn Screening Action Network in 2020. My rare disease journey began, as many of yours probably has, by force. This is my daughter Victoria. She was born in July of 2014. At 5 months old, she became a completely different baby. It was as though someone had flipped a light switch. And at 6.5 months old, Tori was diagnosed with Krabbe disease, and she died at 20 months of age. My advocacy began in that small room on diagnosis day. The neurologist not only told us that our 6.5-month-old baby was dying, but that if we had caught it at birth, we could have treated it. I realized in that moment that this was always supposed to be my story as much as I wanted to resist it. My education, experience, and skill set were perfectly suited to fight for change, so I've learned to embrace it. I went from being a first-time parent, desperate to love my child and be the best mother that I could be, to being a parent desperate to save others because I could not save Tori. From someone who knew nothing about newborn screening to someone who is pretty much an expert in it now. Life is certainly full of unexpected turns. How did I go from being just a mom to being an advocate who actually found success in changing the system? I was willing to learn. I listened to understand. I identified the problem, and I worked with stakeholders to refine the plan. Let's begin our journey. While I was caring for Tori, I did what I could from my couch to learn about newborn screening and its history in Pennsylvania. I didn't start actively advocating yet, except for being in the media. Instead, I chose to spend her few remaining days being with her, living life, knowing I would all too soon have plenty of time to advocate. But on a whim, I decided to go to the Capitol for Rare Disease Day that year on March 17th, 2016. It actually may have been the first ever Rare Disease Day in Pennsylvania, but I can't remember. Tori passed away just 10 days later, but that day she helped me to start my advocacy. In April 2016, 3 weeks after Tori died, I attended my first meeting of the Pennsylvania Newborn Screening Advisory Board, and I testified that day about screening for Krabbe. What I learned at that meeting and the ones that followed turned into 3 pieces of legislation over a 4-year period, 2 of which failed due to partisan politics, with eventual success in November of 2020. It also led to me becoming a parent member of the Lysosomal Storage Disorder Subcommittee. While I went in with energy and passion and determination, I had no idea how much I didn't know. Let's pause for a moment. It seems like telling our rare disease story would be enough to change the world, but what I have observed and learned the hard way is that there are some key elements to effective advocacy. If we want to affect change, we need to be humble, and we need to realize that we are trying to change complex systems or parts of a complex system, and that requires effort on our part. As I share my Pennsylvania advocacy experience today, I will throw in some of the lessons I learned each step of the way about what it means to be an effective advocate, which you can see listed here. I won't mention all of these today, but this is part of the effective advocacy series that I have been developing for LDNBS, so you can find it at ldnbs.org. The first lesson I learned, even that day at the first advisory board meeting, was that as we advocate, remember that we want to build relationships, not barriers. The way you speak to decision makers and the actions you take determine which of those are built. You need them on your side. So yelling at them in anger may not be the most effective approach, even if it feels good in the moment. What I wanted to see happen in 2016 seemed really simple. Pennsylvania screening for Krabbe disease. But what I didn't know is that my advocacy vision was a little bit blurry. I had no idea what this was going to take to make this happen. And I certainly never dreamed that it would take 5 years from first meeting until law implementation. But as I listened and learned with fresh ears and a parent's perspective, I began to notice things that the board seemed to ignore. What I learned was standing in my way was a broken funding mechanism. This previously involved the legislature during the budget process, which meant that if newborn screening wasn't a priority, it wouldn't be added. No more conditions could be added. Addition of conditions also relied on the timing of the budget cycle and not on need. In Pennsylvania, there were also 2 different lists or panels of newborn screening conditions. There were 10 that were on the mandatory list, 37 on the supplemental list, and not all hospitals were screening for all supplemental conditions. The most important one to me was that the advisory board, who is filled with experts in rare disease and in treating these conditions, didn't have authority to add conditions, which caused delays and even refusals by those with authority. In one memorable meeting, the advisory board chair commented, "Why are we even here?" After receiving some disappointing news. I can't remember exactly what. But in that moment, I realized that the expertise, the time, the wisdom of the advisory board really should be honored, so that Pennsylvania could become a leader like it is now. So as I learned all of this, my vision became clearer, and I realized that my potential impact in Pennsylvania was greater than just adding Krabbe disease to the panel. Another important lesson I learned was this. Sometimes doing something just for the sake of doing something does more harm than doing nothing. We don't want to break the system to get our way. I have seen some well-intentioned and passionate parents work on poorly written bills that become law and end up making a bigger mess than previously existed. We don't want to break the system just to get our way. So I knew we needed to be careful in how we approached this in Pennsylvania. I quickly learned that states have paved a road for us to take to effect change, especially within newborn screening. This is true for every state, but of course it's going to look different depending on the state. I learned that we don't need legislative mandate to add newborn screening conditions. There are paths to take or paths to be created, like I did. States have paved this road for us, and just because there are potholes and detours along the way doesn't mean that we go off-roading. It means we may need to help fill the potholes. Once I found my own potholes to fill, I began advocating in Pennsylvania. But despite my background and education in politics and political science, I naively assumed that something as common sense as newborn screening reform would be easy. It's nonpartisan. Everyone wants credit for helping children. Piece of cake. No, my journey did not work out like Schoolhouse Rock or my degree said that it would. This is the timeline of our work starting in 2017, but I also included Act 148 of 2014 to show just how long it took for Pennsylvania to begin screening for Krabbe disease. Had that initial bill taken into account everything that I have since learned about our system and made those changes, many lives could have been saved in those 6.5 years. I want to mention that my bills did not add Krabbe disease by legislative mandate, but instead fixed the issues that were preventing it from being included. And sometimes that's what it takes. These are the history screenshots from all 3 bills, and you can see a slow increase in action. We will dive into each one in the next few slides, but I have to admit it's fun to share this journey with people who actually care about these details and not just that I succeeded at the end. So HB 1081 is where it all started after about a year of discussions and writing the bill. I even attended a public hearing of the Human Services Committee and testified, and the bill went nowhere, not even out of that committee. I then gave birth to twins a year later, and I assumed the bill would just finish its journey without help, like Schoolhouse Rock says. but I was very wrong. So after that one failed, we introduced HB 730, which was numbered for Tori's birthday. And then it didn't go anywhere for months. And then it got laid on the table. So after speaking at a newborn screening awareness event at the Capitol on September 25th, 2019, I spontaneously decided to go ask the Speaker of the House why my bill was on the table again. I'm not exaggerating when I say that the conversation that followed changed my life. But also, had I not asked questions on that day, SB 983, which eventually became Act 133 of 2020, would not have happened. I was fortunate enough to get a meeting with the policy advisor to the Speaker of the House, and I asked him why HB 730 was stuck. He looked into it, and then he said these words: "Your bill is dead. They don't want to give the minority party a win." As a side note, this is the day, and actually the moment, when I became nonpartisan, and the day that I realized just how careful we must be to never allow newborn screening to become a partisan talking point. That day, I was given a choice to make, one you likely have been faced with as well throughout your advocacy. You can take these moments of defeat and walk away, and it would be okay. It would be okay. Or you can embrace flexibility and change your course and try again. This taught me that I needed to be flexible. There are always going to be unanticipated hurdles and discoveries as we advocate, so we may have to pivot and be flexible with the asks and the approach. As I experienced, underlying issues in the state may need to be addressed first. In order to really see success and be flexible, we must honor and respect the experience and expertise that each person brings to the table and learn from them. There is never a moment when we know everything. We also must be willing to collaborate because it takes all of us. So for me, flexibility meant finding a new sponsor in the majority party in the Senate. So completely changing my approach, adjusting the bill language after listening to and learning from the stakeholders. The biggest example of this language change was that the Hospital Association of Pennsylvania opposed the proposed newborn screening fee. So we negotiated, and what they suggested actually was a better solution that in the long run will mean we can screen for more babies. It also included building a team behind the scenes that I could ask for advice. These were people who couldn't publicly lobby, but who knew the system. This did end up including the Speaker's policy advisor, who became one of my greatest allies. Also, the help of the legislative director for my senator was absolutely key in this entire process. Don't underestimate the staff. All right, so in November of 2019, I met with my senator and his legislative director, explained the situation, and requested that he introduce a companion bill to HB 730 in the Senate. He quickly agreed, assuming that it would be easy. We introduced it on January 15th, 2020, and we knew that time was not on our side because the end of the session was scheduled for September. But we could not have predicted our next hurdle, though you probably already have. That's right, a global pandemic. To say that I felt discouraged is an absolute understatement. In fact, there were definitely tears the day that the House decided, or the legislature announced that they were pausing. I absolutely felt defeated. This was the third time that I might fail because of something as serious as a global pandemic. I had to laugh at the situation because what else could I do? But it did make me question if I should keep going, if I could keep going, but I did. So in this moment, flexibility turned into doing what I could virtually during a global pandemic while running out of session days. I will say that in the end, COVID meant that they needed to add session days in order to finish all of their business, which ended up being the only reason we were able to have success. But we couldn't see that in March. The next lesson I was about to learn was this: newborn screening and other health-related policy does not exist in a vacuum, and we must be aware of potential domino effects of our actions. This is why we must involve stakeholders, learn from them, and not act on our own. In July, we began a series of virtual stakeholder meetings and received input that led us to change the bill language for the better before it was ever heard in committee. This included the Insurance Federation, the Hospital Association, the Academy of Pediatricians, as many groups that were impacted by newborn screening as we could think of. So we were able to do that, and then it was in committee on September 21st. We had a scary moment in October where the bill almost became partisan while in the House Human Services Committee, but we prevailed, and on November 19th of 2020, it passed the House unanimously. SB 983 was signed into law 6 days later, which means that I got the bill from the committee to the governor's desk in 2 months. This photo is from our ceremonial signing of Act 133 of 2020, which finally happened in September of 22. It was really frustrating to have to wait that long to have this moment captured, but because we had to wait, I was able to tell Governor Wolf what his signature had actually done. So few times are politicians thanked or given these good reports of what they've done. They usually just hear complaints. So I was so excited to get to tell him what had happened. I also used this photo to illustrate two things. One, it was a team effort. Everyone you see in this photo played a part, whether it was publicly or behind the scenes. And the changes we succeeded in making only happened because we listened to understand. So what did Act 133 of 2020 accomplish? First, it made screening equal from hospital to hospital and made every condition on our panels mandatory. It aligned Pennsylvania with the federal recommended uniform screening panel. It shifted the majority of funding for newborn screening to insurance. It gave the advisory board the authority to add conditions. And because of the way that we reformulated the system, we can now add a new condition in 6 months or less. Most importantly, the legislature is not involved. There are really, really compelling arguments for why legislative mandates should not be used to add newborn screening conditions. And I'd be happy to go into that if you have questions. The Pennsylvania Advisory Board also, because of my advocacy and my persistence, chose to add Krabbe disease, and we became the 9th state to screen for Krabbe. Sometimes it takes creative solutions to make newborn screening for your condition a reality in your state. Most importantly, this is what our work accomplished. Since screening for Krabbe disease in Pennsylvania began in May of 2021, 5 babies have been identified with Krabbe and have received life-saving treatment. In 2022, 2 more were identified as being at risk of late onset and are being monitored. This is Tori's legacy. Maybe like me, you advocate to leave a legacy for your child or your loved one. I have come to believe that how we leave that legacy matters more than the legacy itself. As Lin-Manuel Miranda so eloquently wrote in Hamilton, what is a legacy? It's planting seeds in a garden you never get to see. As we advocate, as we seek to make the world a better place, we are each planting seeds in a garden that continues to grow and change. Sometimes a little drought happens and we feel like we will never see the fruits of our labor, but I believe that we will. We all want to leave a legacy for our children, but how we accomplish that legacy matters more than the legacy itself. I don't want Tori to be forgotten. I don't want our loss to have been in vain. So I advocate and do what I can with what I have to make a difference. A legacy. As I have done this for the past 9 years, I have come to believe what this says. We must accomplish the legacy well. When I began my advocacy journey, I was grieving, angry, and I allowed that to influence my early conversations with decision makers. It is so important that we do not use our pain and grief as a weapon, but instead use them as a tool for greater impact. You may get what you wanted, but how will you be remembered for future asks? Do you want people to remember you and your loved one positively or negatively? Don't use your grief as a weapon. I wrote this in my book, and I thought it was a fitting way to conclude this presentation. The depth of my love for my daughter is not measured by the number of tears I have cried, but rather by the life I choose to live in her absence. And today I would add this. And in her absence, I choose to advocate with kindness, respect, humility, and a willingness to collaborate with and learn from others who know more than me. I hope you accomplish what it is you are hoping to do, and I hope these little bits of wisdom are helpful in being an effective advocate, whether it's here in Pennsylvania or elsewhere. Thank you, and please reach out if I can help in any way.